With that, I'm going to move over to the next segment of Medifile tonight, and I have the absolute pleasure of welcoming into the studio two very special people, one of which I met and had the pleasure of working with last year. And then the second one is obviously very new, so welcome aboard. Thank you for joining us, Ashwin. And I welcome back into the studio Nolene. They're representing the PinkDrive. And of course, yes, last year I had a two-part program focusing on PinkDrive, and I myself, might I say, wasn't sure about what exactly was PinkDrive. And I was like, what is this big truck going to be doing here? All right, up until I had the pleasure of talking to you and your team. But right now, for the listeners that's joining us for the first time and want to know what exactly is PinkDrive about.
Thank you very much, Samantha, and good evening to the listeners. My name is Nolene Cochin, and I'm the CEO and founder of PinkDrive. We're very honored to be back here in your community. PinkDrive started out 11 years ago as a breast cancer organization, and we wanted to take healthcare, and in this case breast cancer screening, to the indigenous population across South Africa. And really, we're all about early detection can prolong a life. So I went out, built the first truck, put in mammography equipment, and we literally hit the road running or turning, wheels turning. Whilst we were delivering these services, we soon realized that there was a far bigger need in the communities that we were visiting, and hence we immediately adapted our program to include cervical cancer screening as well. So our focuses then was breast cancer and cervical cancer. However, once again, going into the communities and realizing that there's a need for the men as well, we had changed our program again, and then added on the PSA screening for prostate cancer and education around testicular cancers. So our main focus is cancer, but the need for mobile health services is so big in this country, and we are all about reaching the population. So taking that healthcare service into a community and not expecting the community to come to us. With the start of COVID, we immediately changed again, and I went out, offered all our medical staff to National Department of Health, and said we will now assist with COVID testing and screening. So that's where we are now. We're addressing the cancer side of things as well as providing the services for COVID testing and screening. And without a doubt, we might have been going through the second wave, which has truly been worse. But COVID's here to stay. And we've all got to take responsibility. We've all got to try and do the best that we can for ourselves. Because we can't expect government to do this, and we can only really work with government and try and save as many lives as possible.
Most definitely. And I have to tell our listeners right now, sitting across from Nolene, all I see is dynamic female power. I see inspiration, all right, and an amazing cancer fighter herself. I'm truly and really inspired by you and the work you do, Nolene.
Thank you, Samantha.
And
I'm humbled.
I have to also tell you that Nolene's team definitely is not just about the pink and the ladies, okay? I have a gentleman in front of me right now that's joining me on Medifile tonight, and he's in a pink shirt, might I tell you, as well. All right. So welcome into the studio, Ashwin. Thank you for joining us.
Thank you, Samantha. I think, please permit me to reflect a bit on a privilege and honor to address and be able to speak to the passions in my heart. First of all, let me root for my city of birth. I'm actually born in Durban.
Wow, okay.
I've raised in Durban. I studied in Durban.
Okay.
My career took me out of Durban. And
Okay.
today I drove back home. And the feeling of entering the city is just inspiring itself. The mugginess, absolutely. Classical, it says I'm home. My journey with PinkDrive started 10 years ago
Wow.
and has never looked back since.
Wonderful.
The synergies between its founder and my own background and what my parents did as people with benevolence, charities in the greater Durban area, born in Sydenham, it was just a follow through for me. Being in the medical profession just added that additional dimension of substance to what I grew up to do as a child in the type of charities that my parents were involved. When it comes to an organization like PinkDrive, with a founder at its helm, with the passion and the deep sense of service that Nolene has actually demonstrated to all and sundry, those who have come into contact with her, including yourself, is usually realized through a whole lot of team efforts, but not without the person who's actually inspiring and rooting and egging people on. And knowing
The
Nolene,
pilot, of course, yes, is very
and
important.
knowing Nolene, it's very difficult to say no. And no is not in our vocabulary as an organization as well. We will and we can is something that we will always tell ourselves, and we would make things happen. So when you see us on the road, it almost belies the years and years of dedication from Nolene and the team. And I'm at a board level, but every so now and again I've got to get into the thick of things, and it's not an issue to be able to do so as a medical practitioner. But more importantly, the nature of health standards is critical, and that sits in my lap to ensure that the standard of care, the nature of the description of care, how and why patients must be managed like the way they did, and how citizens must actually be educated, all fall in my area of responsibility on the board. As the immediate past chairperson, it's no different now. I now act as a medical person on the board.
Okay.
I had other colleagues on the board that actually participated and lifted this responsibility, but now returning back into ordinary directorship, it just gives me more opportunity to dig deeper and reach further, because there are parts of our country and there are communities that are very, very deserving. And it's a difficult thing, as I said, to say no. So when people ask, then Nolene and I and the team put our heads together and says, how do we make it happen?
Fantastic. Very quickly, I want to ask about now initiatives and assistance for people during COVID-19. With obviously restrictions in place right now with the movement, and I would say for the last year, it might have been a huge challenge driving out your programs, having the truck go out, having your staff be at risk. I'm sure you have kept a maximum amount of patients that you could see. But with regards to reaching out to patients remotely, how exactly have you been able to do this?
Well, it's as Nolene says, the wheels turn. So when there's a requirement, and in this instance we're working very, very closely with government on the screening and the education in respect of identifying communities at risk, the wheels turn. Because the truck is available, we are very flexible. So the part that actually does this cancer screening is actually suspended for a while, and the rest of the infrastructure of the truck is then used to perform what is a basic primary healthcare responsibility, but with a focus on addressing a pandemic in the country. So the distances must be covered, but the planning to ensure that that happens is quite involved, and it's not to be glossed over, and we make sure that every cent that's actually provided to us, be it a governmental source or a quasi-governmental source or even a corporate source.
Well, you've literally just taken this all out of my mouth. My next question was, how exactly do you get all this money? Because you guys look like you really have a plan in place. And it's not just some mediocre kind of service. I must be honest, I've stepped into your truck last year and I was wowed. The technology that you have, the infrastructure that you've actually, have in place there, the staff. I mean, everything is just so perfectly set out. I literally would say, listen, I'm in a little bit of a private suite right now. How exactly do you maintain all of this funding?
May I, Nolene? So the person who spearheads it is actually sitting in the room. Nolene comes with a wealth of humanness. Because I've watched Nolene in a room talking to a board chairperson and appealing to their sense of service and of benevolence, and we've never walked out without getting a cent. There's a style in her, and I think, as I said, it comes from her humanness, not humaneness. I'm saying humanness because the person in the person is what I've seen operating. The competence comes from her professional abilities, but there's a human side of what she does that just wins the corporates over. Ashwin, I want to do the following things, but don't worry. If you can actually design how this thing is going to happen, I'll find the money. And I guarantee you, within 24, 48 hours, Ashwin, I found the money.
Wow.
And off we go.
I want you on my team, Nolene.
Off we go. And we work as a team because when it's the hard yards, can we see your financials? Then that's left to me because I actually conduct the business. The business side of PinkDrive rests with me. Even whilst I was the chairperson, I took it upon myself and said to my fellow colleagues on the board, I'm also a businessman on the side. I said, when we actually run this non-profit organization, we'll run it on fair business principles, and we'll work that hard. We'll see how we're going to stretch every rand that we get. And I'm pleased to say that almost 12 years down the line, for every rand that we get, 82 cents is actually spent on the person who's receiving our service.
Wow.
Only 8 cents is spent on the staff and the
Yes.
support. Yeah.
Fantastic. Ashwin, when it comes to patient selection and patient funding, so I know I've witnessed just one event thus far. I'm hoping to be involved in many others in the future. I've obviously looked at a community that I live in and that was in dire need. The numbers were ridiculous the last time you had come over. How exactly does the selection procedure go in? Number one. And number two, when it comes to funding these kind of things, so if you get into an area and a person may be a little well off, they can afford a certain amount of something, but they still cannot afford that mammogram because they don't have that kind of excess cash. So how exactly do you cater for those kind of patients? Do you ask them to pay up front a certain amount?
So let's start with the first one. We have a very, very organized and defined selection process. We have an instrument called a Memorandum of Understanding with a province, the Department of Health of a province.
Okay.
In there is described exactly how we will touch the community, who we will see, and under what circumstances, so that everybody has a chance to actually have FaceTime with us. But it's done through the institution. Like, for instance, tomorrow at R.K. Khan Hospital, the patients will actually walk through the hospital, get registered in the hospital.
So there's strong collaboration.
There is an absolute collaboration, not even strong. The word is, if that collaboration is not in place, we can't go. The legal premise of what we have to do is based on that arrangement.
Fantastic.
To be signed off.
I love your model purely because you're not reinventing the wheel as you go along.
We are using the current channels of access for patients to say we are going to be there. And even when we go into the community and we're not close enough to, for example, the clinic, it did not matter. As long as the clinic is the point that enabled us to be in that community, we'll go deep into the rural area because we're enabled through that clinic, which is 85 kilometers away.
Brilliant.
When it comes to the funding, we have meticulous budgeting instruments that will look at the nature of the service that is being asked for and how to then match that service with the type of staff, infrastructure, including the truck. Whichever truck that we have, one of 4 that's actually available to us, which one we will choose and why. And when we actually do that, that's the matching that actually happens that says, right, Nolene, we need to go and get some money to the corporates, then she go and present the case of that particular project to the corporates and says, this is what we're going to do, this is why we're doing it, this is the number of people we will see as a minimum. And the corporates look at the program, and remember they have financial experts that actually do the due diligence on our budgeting.
Yes.
And eventually we are given the money. It's hard work to get the money, but just like everything in life, if you don't put your shoulder to the cudgel, nothing happens. So hence everybody who has the ability to be able to unlock funds is given the chance to do so. That if the driver says, no, I've got an uncle who's got a shop there, whatever it is, says, no, let's go and see what can be provided. The last part is that we have a policy that says wherever a paying patient can afford the cost of our services, then that money will then subsidize a person who does not have the money. So for example, when Nolene provides a service to a person who can afford the mammogram at the fee that we charge, then that fee can do 8 other patients who do not have a cent.
Wow.
Yes,
Amazing.
that's the model of translation we are able to do, because the asset that we own allows us to translate, including the operation of the asset, into the actual service in that amount of proportion. In other words, for every one fee that a paying person can charge, I can do 8 other patients that can't afford it to the same health standard. The standard is not compromised.
Fantastic.
It's just that we don't make them pay.
So to round up our discussion very quickly, is something that I often get asked, and I want to, in all honesty, ask you as well. I have constant request for support, counseling, testing, these kind of things. Is there an opportunity, or is there a forum within which our listeners can contact PinkDrive? Do you have a counseling center? Do you have a toll-free number where they could get support directly from you?
Nolene?
We don't have a toll-free number, unfortunately, at this stage, but we get contacted by not only listeners, and anyone out there, all the time. So there is a number here in Durban, and I've got a representative in Durban by the name of Janice Benneker. Can just go onto our website. All the details are on the website of Janice. Alternatively, there's a Johannesburg number, which is 011 998 8022, and you can always ask for me. My name is Nolene, and I will gladly help you, and wherever we can direct. Whilst we don't have our own counselling service, we are aligned, affiliated to all the cancer counselling services, those NGOs that offer that service right across South Africa.
Great.
To add, social media is also used. So a few contacts actually come through postings on our Facebook page.
Wonderful.
Where people ask the questions, then it gets picked up by somebody, the person who's monitoring the Facebook page on a constant basis. And then there's also the behind the scenes strong network of colleagues that I actually have. So it's not unusual for Nolene to say, you know what, we've got a patient here and they require this kind of referral. Ashwin, do you know anybody? And I'll pick up the phone and through my networks enable colleagues who are willing to render that service at no cost.
Definitely a retirement project. Nolene, I'm going to apply to work with your team.
I'll take you any day, Samantha.
Well, with that, I want to say thank you so much, and I want to wish you all the best for your stay in Durban. And absolutely any point in time, I'm happy to host you on Medifile and share knowledge of your field. Of course, yes, more importantly, share your initiatives with our communities at any point in time.
Thank you, Samantha. Just sorry for the last 10 seconds.
Sure.
I want to pay tribute to Nolene, because Nolene doesn't know how to stop. And dare I say this with her permission, she is a COVID warrior. She has been afflicted by the virus, but it never stopped her. And she's here today, and her oxygen machine is with us. So that ultimately, if there's a requirement, and tonight she's going to go on the oxygen because the doctor says, Nolene, you've got to go on your 8 hours of oxygen.
My God.
Tomorrow is a new day.
I remember when I got the message that Nolene's in hospital, and I just sent her, a message, and I said, listen, I'm sending you all my love, all my best wishes. And I really did say a prayer for you, Nolene, saying, God, take care of her. This woman is dynamic. It's too soon for anything to happen. You need her to continue the work she's doing. So, Nolene, I want to say to you, thank you so much. Thank you so much, Ashwin, for joining us.
You're welcome.
God bless you for all of the wonderful work you're doing. And let's hope more and more people can take a note of your actions, your examples, and sort of join forces with you to provide more services to our community.
Thank you, and thank you to the listeners for listening to us. And all I can say is stay safe, mask up, sanitize, and social distance.
Thank you. Thank you so much, Ashwin.
We are humble. Thank you, Samantha.
All right. Well, that's our bit right here on Medifile. It's been the first program for 2021. I'm going to be back next week, Wednesday, for yet again another edition of Hindvani Medifile. And of course, yes, today's program was a two-part tribute to our health heroes. And of course, yes, talking about World Cancer Day tomorrow, we have just spoken to Ashwin and Nolene from the PinkDrive. Well, it's at that time I'm going to say thank you and goodbye. Being the beginning of the year, however, I'd like to leave you with a piece of music. It's an English piece of music, a very devotional piece of music, which touched my heart like peace, peace, peace. All right. And it was something that I felt that was so appropriate going into the new year. And it's basically saying, God, let me live according to your will. Thy will be done. And just asking God to live with you through every thought, through every word, and ultimately through every action. Samantha Maharaj की तरफ से नमस्ते, नमस्कार और शिवरात्रि, और मेरी आशा है कि भगवान जी के आशीर्वाद सिर्फ आपके साथ रहे. नमस्कार.
This is a friendly reminder to all South Africans to follow the lockdown regulations to curb COVID-19 infections. Wearing a mask in public is mandatory. Maintain at least a 2-meter distance all around. Sanitize or wash your hands as often as possible. To all those that are following the regulations, thank you for being responsible citizens. Let us all be part of the solution, not the problem. Hindvani supports a COVID-free environment.